Our exam is going to be based around, of course, ruling out neuro, like we said. You've done all that. Now we got to see where the mobility problem is. And there's a very quick, simple way to rule in or rule out an upper versus a non-upper cervical mobility problem. And I want to share this with you because many of you just starting out, you're excited to get into sports, and you may not have had a lot of manual therapy training, and you may not have developed the ability to feel joint play appropriately and make these decisions at the joint level. So we're going to give you a little bit more functional way to do that. First, we're going to determine if there is a flexion-oriented problem in the, what I'm going to call the upper cervical spine, so that OA joint. So we're going to put the patient in full rotation and see how they do with a little nod. And if they can nod appropriately each way, that OA joint's responsible for about 20 degrees of flexion. If they have that available to them, then we're going to say from a flexion perspective that that upper cervical spine is clear for mobility. Now, for rotation, we're going to put them into flexion and check rotation. So we're going to lock them out now into flexion and check rotation, a classic C1, C2 rotation test. Should have about 45 degrees of rotation available to you. And if the athlete does have 45 degrees rotation in a fully flexed posture, then we're going to say you're fine in the upper cervical spine for rotation. Now, this is important to rule in or rule out this upper cervical spine right away, because if flexion is the mobility that we're going for and it's an upper cervical OA flexion problem, that's where we need to treat them, right? Rotation, same thing. If the rotation deficit is coming from C1, 2, that's half your rotation. We need to treat that. And I would say most of the time in athletes, what you'll see is they're clear in the upper cervical spine. They've got problems lower, but it's always nice to start and check there first. That's a nice quick way to do that.